Hi there. Thanks for joining me today for this little mini chat, little mini education session. I've been thinking about World COPD Day that's coming up, and our theme for this year is being active when you have COPD. So I wanted to do a little bit of an education session, a little bit of recording, so we would be able to refer back to the things to watch out for when you are exercising when you have COPD because exercise is not only safe, it's essential. So we really want everybody to feel comfortable doing some exercise because we know there's lots of benefits, and I'm going to talk to you about that. So let me just get set up. We'll play a little bit of, let's have some background music, and then I'm going to we'll share my screen. And so the first thing I'll say is congratulations. Congratulations for being willing to put yourself out there and to recognize that exercise is important and making that choice to do it. Because I know it's not easy. I know that if exercise was easy, absolutely everybody would do it because we all know it's good for us. And I also know that when you have lung disease and you're having trouble breathing, it's really scary, terrifying even to think about exercising. So good for you for putting yourself out there and choosing to do something that is good for you. So when you have lung disease and we exercise, there's so many good benefits. One is people with lung disease that exercise tend to get fewer chest infections. And if you do get a chest infection, you need less medication. Your body is better able to fight those infections off. You're less likely to need hospital care. And all those things are really important because that saves us lung tissue, right? Anytime you have an infection, the concern is that you're going to lose lung tissue. We want to conserve as much lung tissue as we're able. So exercising helps to deal with that. The other thing that people with COPD, for a lot of reasons, they tend to be at a higher risk of fall. So if we're exercising and we're working on our strength and our balance, we're less likely to have a fall. The other thing, one of the most important things is as we get fitter and stronger, our muscles become much better at using oxygen. So we need less oxygen to do any given activity. One, because the muscle is fitter and stronger, but also because the muscle tissue itself becomes better at taking the oxygen out of the blood and using it. It becomes more sensitive to the oxygen that is delivered. So lots of really good reasons to exercise when you've got lung disease. The other side of it is once we're exercising and we're doing something that we feel like we can take control of, that makes us feel good too. So it can elevate our mood. So when we're exercising, we obviously want to do so safely and effectively. So we want to make sure that the exercise that we're doing is going to be safe for us, but also we want to make sure that the exercise that we're doing is going to create change in our body. So we want to work hard enough that we're getting some of those benefits, but we also want to be safe when we're doing that. And so there's a few ways that we can work both ends of that spectrum. So when we're exercising, for safety, have your rescue inhaler close by, right? Some people need to take the rescue inhaler before they start exercising. So that's something to talk to your respirologist or your family doctor or your nurse practitioner about. Is that something that you should be doing before exercising, taking your rescue inhaler? Some people do. While we're exercising, we're going to use our breathing strategies. So we're going to use our pursed lip breathing, where we're breathing in through our nose, blowing out, like we're going to whistle, blowing out not forcefully, but blowing out like you were going to flicker the flame on a candle. So not quite blowing it out, but you're going to blow hard enough that you're going to flicker that flame. And the trick is you want to blow out for more counts than breathing in. Now that's going to take some practice, and that's okay because we can work on that. But what that does is it helps to empty your lungs to reduce that air trapping that you can have. If we don't reduce that air trapping, then that air trapping becomes greater and it makes you feel more short of breath, which then makes us want to stop exercising. So it's a strategy that we sometimes need to take some practice doing. Then the other thing that you want to do to make sure that you're working hard enough is we want to be doing some strength training. You know, a lot of people will say that they're active, they do lots of things during the day, that they do some walking, but the piece that often is missing is the strengthening piece. So I want you to be doing some exercises that are going to strengthen your arm muscles, your leg muscles, and your trunk muscles. When we're lifting a weight, when we're doing our exercise, I always like to follow the rule of 10. So with that weight, I want you to be able to do 10 repetitions. So maybe 10 bicep curls. If you can't get to 10, that weight is too heavy. Okay. If you can get to 10 and then keep going and going, it's too light. So the right spot to be in is when you get to number, say, 7 or 8, and you're thinking, oh, I'm so glad there's only 2 or 3 repetitions left, then that's the right weight to be using. So those last couple, 2 or 3 repetitions need to be a challenge. Okay. When we're working on activities that are going to make us short of breath, like some more vigorous activities, like maybe walking or marching, that sort of thing, you can use the board breathlessness scale. And that is that scale of 0 to 10, where you ask yourself, how short of breath am I? And when you're exercising, we should be a 3, 4, or 5, somewhere on that scale of moderate to intense activity. Um, if you have a finger monitor, you're going to slip that finger monitor on your finger as well. So when you're working at say a 4, you want to slip that finger monitor on and make sure that that finger pulse oximeter is telling you the right range that you're in. So whatever that range of oxygen saturation that your provider, like your respirologist or your family doctor, your nurse practitioner, or your respiratory therapist that works with you for your home oxygen, if you're on it, you want to make sure that that number is in the right range. So you're working hard enough that you're getting some benefit, but not too hard. So the other rule of thumb, there's a couple other rules of thumb that you want to be able to, when you stop exercising, when you exercise, if you're exercising, you should be a little bit short of breath, like you're doing a vigorous walk, you're marching on the spot, you're on your treadmill, you're maybe on a stationary bike. You want to be a little bit short of breath, moderate to intensely short of breath, to make those changes in your body. But you want to, when you finish exercising, your finger monitor is telling you're still in the safe range, but also you want to be able to, when you sit down, that you start to recover fairly quickly, that breathing rate starts to come back down. Okay. The other thing is a talk test. So when you're exercising, you should still be able to carry on a pretty decent conversation. You could get your idea across. You shouldn't be so short of breath that you can't form words. Okay. Other ways to be safe, keep that inhaler close by again, just in case you need it while you're exercising. Exercise with a buddy. So having somebody you're with in case something untoward happens, there's somebody with you. Make sure you're rehydrating. So if you produce mucus, if you have a productive cough, you don't want to get so dehydrated that your mucus gets sticky. So you want to make sure you're rehydrating, and then also have a means of communication close by. Like have a phone and phone numbers written down or preloaded into your phone, just to make sure that you're safe. So you want to make sure you're working hard enough to get those changes in your body, but also be safe. So have your buddy, have your phone, have those ways of self-monitoring to make sure that that you're in that right zone. So, exercise, what kinds of things are you going to do? Well, you're going to do a basic kind of an exercise program with a few little adaptations. So you're going to do your cardio exercise just like anybody needs to do a little bit of cardio, but you're going to make sure you're using your board breathlessness scale. You're going to make sure you're using your finger monitor if you have one, or you're going to be using that talk test to make sure you're not working too hard. You also want to focus on your breathing strategies, breathing in through your nose, out through your mouth, and you're going to work on blowing out for longer than breathing in. You're also going to do some flexibility, some mobility, making sure your joints and your muscles can move through the range of motion that we want them to move to be functional. When you're doing stretching, we want to make sure we're not holding our breath. Anytime we're doing something that's a little bit effortful or a little bit uncomfortable, our automatic reaction is to hold our breath. So when we're stretching, we want to make sure that we're focusing on blowing out. Our stretches we want to hold for anywhere from whatever you're able at first. Maybe that's 5 seconds, 10 seconds, up to even a minute. So kind of working on that, stretching all those main muscles. Again, we're going to work on breathing throughout all of our exercises. Pursed breathing, and then blowing out for longer than breathing in. I also mentioned before that you need to do some strengthening exercises, strengthening the major muscle groups, particularly your lower extremity, your legs, your glutes. Making sure those muscles are really strong is really important. One, because those muscles are really important for function, but also because those muscles eat up a lot of oxygen, right? So we want to make sure they're nice and strong. But then also your trunk muscles and your arm muscles, because those are important because they attach to your chest wall, which affects your breathing. So we need those muscles to be nice and strong as well. And again, making sure that as we're doing that strengthening, as we're doing that effortful part of the movement, so bicep curl, curling up, you're going to make sure you're blowing out as you are doing that harder part of the activity. If you're doing a sit to stand, as you're standing up, you're going to work on blowing out just to make sure you're not holding your breath. And then you're going to add in a little bit of balance activity in your exercise program as well. Again, not holding your breath as you're trying to work on that. When to stop. So if you're finding that you have certainly anything that's a sharp pain, so either that's a sharp pain in your chest, your jaw, pain down your arm, a sharp pain in one of your joints, that's definitely a reason to stop and ask for help. If you have sudden weakness, if you're feeling dizzy, lightheaded, if your heart starts to beat really rapidly or irregularly, that's a reason to stop and get help. If you start to get really overheated, for sure, another reason to make sure that you're making a change, that you're stopping what you're doing. And of course, if your oxygen level gets too low, or you're excessively short of breath, or really if there's any other symptom of concern when you're exercising, it's always better to be on the safe side to stop and get some help. Again, really good for you guys to keep at the exercise. I know it's really hard to do. If you need any help, certainly reach out to me. I'm around. I've got lots of programs that we can use to find the right one for you or set you up with what you need to do at Evolve. Thanks for listening.